Here we go, virtual knee surgery. It says beta, but it's fine. I've played this before. Surgery, it's not surgery simulator. This is like educational, basically. This is educational surgery. Content warning, there is, you know, some blood as it is illustrated anatomy, but this is like intended, this is a kid's game, sort of. So there's nothing too objectionable aside from, you know, you might see some illustrations of organs. But I just want to be safe. If that bothers you, feel free to look away from the screen. If you want to hang out and just listen, I will tell you what's going on. And they will describe it in the audio as well. This is the same game I used to play. Oh my gosh, it's literally been more than 10 years. So this is a knee replacement.
Welcome to virtual knee surgery.
Love
this activity will show you the process of replacing a failing knee joint. Are you ready?
Okay, so here we look at these vital signs and make sure that the patient's vital signs are within acceptable parameters for us to go through the surgery. Because, you know, as much as we try to keep surgery safe these days, it's still quite an ordeal for the body to go through being cut open and, like, having things messed around with, even if it's going to be beneficial in the long run. And anesthesia has to be dosed very, very carefully because based on, you know, patient, their weight, their size in general, their, like, other needs, like people with red hair or who regularly use cannabis may react differently to anesthesia than, like, someone who doesn't. So we're going to look at these, and these are just normal vitals for adults. Temperature between 97 and 99. Heart rate normal is 60 to 100 beats per minute. That's for an adult. A child is going to have a faster heartbeat. Children are not just tiny adults. Medicine is entirely different for children. That's why pediatrics is a separate specialization. Your systolic. So when we listen to blood pressure, that's how it works. So one of my favorite medical words is sphygmomanometer, which is the blood pressure cuff, basically. It measures it. I have one over here, but I can't really do it on myself. The systolic is the pressure that your blood has going through the veins. And the diastolic is going through your arteries, The diastolic is the pressure that it has coming back. So the arteries carry blood away from the heart and to the rest of the body. That oxygenated blood carried, like, to all your cells because they need oxygen to function. And then they return that deoxygenated blood. That's when your red blood cells aren't bright red anymore. They're a little darker. The diastolic is the pressure in the veins that take blood back to the heart. That's what veins do. Veins take blood back to the heart. Arteries take blood away from the heart. As for your pulse oxygen, when it comes to pulse oxygen, those are those little clippy things you put on your finger, and they basically shine a laser into their... That's true. They basically shine a laser into your skin and measure how red the red blood cells in there are. And red blood cells are brighter red when there is more oxygen in them because of that hemoglobin that we have. So it's going to measure how red those red blood cells are and tell you how much oxygen is in them based on that. So you always want to have your pulse oxygen above 90. Anything above 90 is fine. Things start to go downhill faster once it gets below 90. Let's look at the patient's vital signs. Wouldn't it be funny if they have blue blood because they have a different compound in there. Wouldn't it be funny if the game was just realizing that the vitals weren't good enough and just you couldn't play the game? Anyway, so 98.5 between all of these parameters looks good to me.
It looks like surgery will proceed as planned.
Good.
Take a moment to look at our patient's x-rays.
So here, we've all had an x-ray, yes. X-rays use those strong radiation rays, which modern x-rays should not give you any problem with radiation. I have a video about it on my YouTube channel. An x-ray, yeah, you're going to get exposed to some radiation, but it's a teeny amount, like way less than you're exposed to just existing for a year on Earth. We're all exposed to a little bit of ionizing radiation all the time, but it's not enough to, like, cause huge problems. It can cause huge problems when you're exposed to a lot at once, but a modern x-ray, not a problem. So we're going to look at these, and usually a knee replacement, especially in an older patient like this, is going to be because something's going on with the bones. So between our joints, we have things that cushion them. So if your knee were just like straight up in contact with the bone, it would hurt all the time because your bones are really sensitive. However, that's why we have a little bit of a cushion there. But with things like arthritis or even just wear and tear with age, those cushioning materials are going to start wearing away. So if bone starts actually rubbing on bone, that's going to hurt. It's going to make it hard to walk or do anything or bear weight on those knees. So these kinds of knee replacements are going to hopefully prevent the patient from experiencing any further pain or mobility limitations. To me, it looks like this one is the one that doesn't have that usual cushioning. We can see on the right knee, the bones, there's a little bit of space between them. But the left knee, we can see here, part of that is kind of like tilting onto the bone. So that's going to hurt our patient.
You're right. His left knee appears worn down and lacking cartilage, which is likely the cause of his pain. The nurse has begun prepping our patient for surgery by placing an IV needle in his right hand. Now it's your turn. Use the marker and write your initials on the proper knee to be operated on.
You can write any initials you want.
But it's an actual step taken
I
to
think.
prevent wrong site surgeries.
It's true. And that has happened. I've heard stories from the operating room. This is like I used to play this literally over a decade ago, but it's good educational stuff. There actually have been instances where the wrong knee was operated on, and then you have to do the surgery all over again. There are also people who are so worried about that happening that they will write on the other body part, not here, or something like that for the surgeon to see. And I have heard stories, I wasn't there, but I have heard stories of that actually preventing incorrect operations. So generally it's not a problem. This is, most surgeons are very diligent and they're going to be really careful and they're going to make sure, that's why we write our initials, they're going to make sure they're operating on the right thing, but it has been known to happen. They're human. So when it comes to which one is left and which one's right, we use the patient's left and right. So when we think about it from the patient's perspective, this would be the left knee because this is the patient's left knee. My knee right here. This is my left knee, but to someone facing me, it might look like my right knee. But it's not. It's my left knee. So we go by the patient's perspective and we go by how they would be in what's called the anatomical position. The anatomical position, I'll explain this real quick. The anatomical position is the patient basically facing forward, their hands out like this. The hands are supine, which prone is lying on your stomach. This is prone. And supine is lying like this. Not necessarily, pointing your feet. I just do that because I took ballet classes. So the anatomical position is how if you hear someone say this body part is superior to this body part, they don't mean that body part is cooler or better in some way. Superior means above. Inferior means below. There's a whole bunch of medical terminology that doctors use to refer to locations in the body, and it all is just referenced in the anatomical position, which is like this. The patient standing upright or, facing upright, and the hands facing the same way as the head. That's the anatomical position. Why did I come back from my nap to a view of... No! I am not! We're doing a surgery game. And I'm surprised it works, because, Chrome doesn't support Flash anymore. So that's the anatomical position. And that's why we say it's the patient's left leg, even if it's on the right for us as the surgeon. So, you can write anything you want. I'm going to write the word butt. There we go. There we go.
The anesthesiologist administers drugs through the IV and through a mask over the patient's face. What function should these drugs perform?
So, there are a bunch of different things that the anesthesia does when they put you under. This is called general anesthesia. Local anesthesia is when they numb just one part of your body, but you're still awake. General anesthesia is when they put you under. So, obviously it's going to kill pain. What? Okay, I guess not. I guess if you're asleep, you can't feel the pain. See, this is why I'm not a doctor. So there is a paralytic agent. They don't want you moving. That sounds right.
Nope.
Okay, I guess not. So I guess those are the only ones left.
After the patient is unconscious, and before the first incision is made, clean it in a betadine solution. This
So-
process will limit the chance of bacterial infection.
Obviously, these days, one of the biggest concerns with surgery is infection. And that's what killed most people back in the day. I mean, obviously, even before we had like general anesthetic to put you to sleep, one of the biggest dangers was some kind of infection getting in, especially in the days when doctors thought it was stupid to wash their hands. That was a thing. The first doctor that was like, hey, we should wash our hands, was laughed out of his job. He delivered babies. And he was washing his hands between patients, and he was like, hey, so I'm seeing a lot less deaths of childbed fever, which was what they used to call just any infection that people would get during childbirth and then die of. Or just, get an infection. Sometimes they didn't die from it. But yeah. And so he was like, hey, I've been washing my hands and my patients are dying a lot less. We should do that. And all the other doctors were like, do you think we're dirty? You suck. We hate you. And laughed him out of the clinic. But he was absolutely right. He was so right. It was? But yeah, they were offended, and turns out he was right. And now we have very meticulous scrubbing in procedures for surgeons, and we use things like these curtains and these sheets to hopefully keep germs as far out of the way as possible. Obviously, there are always going to be microorganisms. We as humans have a microbiome just on our bodies that just is. But the surgeon has a mask to hopefully prevent, breathing germs onto, gloves, it's called PPE, personal protective equipment, and in surgery it's especially important. Wow, that's awful. Well, we will recognize him here. Shout out to Ignaz Semmelweis. Thank you for standing for truth. Always wear your PPE. Always. It's used in more than surgery. But in this situation, it's really important that we do everything we can to keep germs out of this incision, which is the name for the cut that they make in the surgery. Because if germs get in, it's going to be way easier for them to just run rampant and cause some kind of horrible infection. If we're going to be taking away the skin, which is one of the first barriers that we have to prevent infection, we got to make sure we don't put any germs in there. So we're going to clean it. That flashing text does not look good. We're just gonna put all of that on there. Betadine. Did they? Well, I'm glad that they did. That probably saved a lot of lives. All right. Oh, we have to do the foot too, I guess. This is what we're talking about.
Good work.
Yay! I was right this time.
To draw the location for our incision.
Yay! We can.
Perpendicular lines too.
Okay, so I can't just write the word "but" this time because we have to draw the line. We have to make a little stencil for the incision, and it's not going to be perfectly straight because I'm using a mouse and I'm not a surgeon. Hello, Doc Tacticat! We're doing a knee replacement surgery. Oh no, I'm doing my best. We haven't killed him yet. I got the questions about anesthetic wrong, but make it easier to match up the skin. That sounds right.
Outstanding.
Yay! Scalpel. All right, so this is the part that's probably going to involve a little bit of, blood and gore. So if that bothers you, look away and I'll describe what I'm doing, as will the game, and you don't have to see it. But it will be pretty minimal. All right, scalpel, the fancy knife that they use for surgery. Here we go. Consensual knife fight, except he's asleep, so I'm the only one with a knife.
This will help decrease blood flow into the surgical field.
Okay, the Bovie. So this cauterizing is basically when we burn the blood vessels closed so that they don't just, keep bleeding everywhere. Cauterization is used as a way to stop bleeding in a lot of settings, but in surgery, of course it's the patient's going to bleed. We just cut him open. We can see a little bit of blood. It would probably be more than this in real life. It's not quite this, quick and easy in real life, but this is a game. So we're going to cauterize the blood vessels so that they will stop bleeding.
elevated and bent so the bones are fully exposed.
All right. We gotta put it at a 90-degree
Now the legs
angle.
at the proper angle.
Oh, I thought it was
Use
90.
a
No,
large jar to
130
remove the
degrees.
Anterior cruciate ligament, or ACL, the meniscus, and any
Hey!
bone spurs that may be lurking about.
Anyone who's had like an ACL injury can attest that the ACL is a really important piece of connective tissue. We now have the bones exposed, and we can see here that some of the bone has been kind of rubbed away from all that having to work the joint and the friction between the joint bones. So we're just gonna kind of sand it off. Very tiny openings, laparoscopic. That's a fun word to say. There are a lot of medical words that are just fun to say. Laparoscopic and sphygmomanometer. So, we have clamps to hold the skin out of the way because obviously, like, it can just go back over. We don't want that. We need a clear operating field. So, we're gonna reshape the bone so that we can replace the knee. And that's, see that right there? This, I did not mean to click that. But that's the patella. That's your kneecap. Did I enjoy etymology before or after? I was interested in medicine first. I've been interested in medicine pretty much my whole life. Like, from the time I was little. Gotta clamp the skin. Yes. So that's your patella. So we're gonna reshape the bone here with these bone spurs. We're gonna cut those off so that the bone can move more smoothly. I don't know where else am I supposed to cut? Oh, the meniscus. I'm pretty sure I did all the bone spurs. Thank you. Am I good? What? No, I'm not.
Tibia and patella, so the new knee components fit properly. A hole must be drilled inside the femur to set up the distal femoral cutting jig and alignment device.
So we know our leg bones, yes? There are multiple major bones in your legs, but I'm just stand up here. But this one, the top one, your femur, at the top of your leg, that's like the biggest, strongest bone in the body. I have heard, I don't know how true it is, but it sounds right to me, that breaking your femur is like the worst pain a human can survive. Don't quote me on that. I've read it on the internet. So we have our femur here, and we have, obviously, like all the knee stuff here, our patella, our kneecap, and then we have our tibia and our fibula back here. So we have two bones in our lower leg. Tibia is the one that's closest to the skin. That's where your shins are. And the fibula is a kind of a thinner one back here that helps provide, more support for the leg. Because as bipeds, our legs are holding up a lot of pressure all the time, especially when you walk or run. As someone, it's pretty subjective. You could bleed out from, oh yeah, because you have that inguinal artery. There's a big artery right here by your femur. And if you break your femur and that blood vessel gets, like, torn in the process, you can die very easily from exsanguination, which is a fancy word for blood loss. Exsanguination, I think, specifically means, like, enough blood to kill you goes out. Inguinal, yes. And you can actually find a pulse here. Generally, that's not what they're going to do at the doctor's office. Much easier to access your, like, radial pulse, I think it's called. Or, honestly, the easiest for me to find is usually the carotid pulse at the neck. But you can find your pulse in all sorts of areas, if you know where to look. You've got your radial pulse, you've got your carotid pulse, you've got your brachial pulse right here, you've got your inguinal one, yes. I mean, your blood vessels are all over. But those are probably the main ones. Those are the ones that I remember. Pedal pulse at your foot, like right here. But, oh, top of your foot. I didn't know about that one. So those are the bones of your leg. Back to surgery. I like the idea that I'm the surgeon here and I'm just like stopping surgery every few minutes. I'm getting sued for malpractice. For sure. Anyway, we need to drill a hole in the femur now. There we go. We have to, click on the pins. There we go. So, especially when I clicked them. Oh, I have to use the mallet. This is actually just what I was about to say. Especially when you're doing surgery on, like, a femur or something, they have to use heavy-duty tools, human bones and such. They require a lot of force to do anything to them because your bones are real strong. Bone saw, like I said, in just some intense equipment. We're cutting off the bones. Your bone marrow, it makes blood cells, which is why it's so important that your bone marrow be in good shape. Perfect.
Two tibial components are inserted separately instead of as one unit.
The plastic spacer can be replaced.
Fantastic.
Agreed. Agreed. So now we're gonna have our patient do the can-can. Like that. Just bend it farther, sir. There we go. You can just sit back and just do this. It doesn't keep going until you click continue. You can just test it and make him kick as long as you want. I like how the anesthesiologist is just standing there, just watching me disrespect the patient's, you know, dignity and such. There we go. Let's just smack the new knee parts around and make sure they really work. There we go. He's just watching. He looks, you can look at the disappointment in his eyes. He's like, oh man, I knew I should have gotten an actual surgeon for this, but you're stuck with me, bud. Alright, he is fully can-canned.
Knees aren't meant to bend sideways, so it's important to determine whether there is a gap or space between the femoral and tibial components.
Thank you.
There's no noticeable gap, so this knee is a good fit. Why do you think there are so many steps taken to ensure proper alignment?
Because knees are important. To provide times for...
Great.
I got all the other cartons right.
Now let's remove them and prepare for the permanent components by applying a special cement compound that binds metal and plastic to bone.
See, it's just like construction.
The technician has mixed up a batch of cement for you to use.
All right, thank you, technician. I appreciate it. I mean, this is my operating room. Why do you suck at your job? And he's probably very often when I'm being the surgeon. The cement, just slather that on there real good.
With the cement in place, the final
like putting peanut butter on a sandwich.
Any excess cement will be scraped off and thrown away.
Yeah, I don't have to do that.
So the new knee components put pressure on each other. This allows
Whoop.
the bone and components to bond with the cement.
Make it whoop.
Cement
There we
can
go.
take Anywhere from 10 to 15 minutes to harden.
Stare deeply into your anesthesiologist's eyes while this happens.
Final time.
There we go! Can time! Dun 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 dun. Have to do it slow because the game is really old. Dun 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 dun. Move the leg right or he's gonna die. Whatever. There we go, we did it.
Patient's new knee
Okay.
looking good. Let's
Looking
focus
good! Better than it
Suture
was.
the deep tissue and fat layers back together.
So, suture needles are curved. It's really interesting. It's to, like, it allows you to more easily keep the stitches steady for a... Oh, okay. Oh, look. Are there secrets? Well, that's really sweet. Thank you for, like, taking the time to let me know your thoughts and everything. That's really sweet. I wish you the best of luck in your future endeavors. It seems like you're doing important stuff. And thanks for letting me know. It's really nice of you to take the time to type all that out. I feel weird doing surgery and, like, doing all this stuff at once. But I appreciate it. And we'll miss ya. If it is ever right for you to come back, We will look forward to welcoming you back with open arms. And if not, I hope your life is wonderful. There we go. There we go. Sutures. I would like to learn to do sutures just because I feel like it's a good skill to have.
For closing the surface incision, you have a choice between the stapler and the suture.
We have a choice. So, I feel like, correct me if I'm wrong, sutures are like more secure but more likely to scar. Staples are less likely to leave as much of a scar but like are easier for them to come out, or it might be the other way around. But there is like a little bit of a difference. We'll do staples though, so because you guys already saw the sutures, so we'll do these. Can I just put them anywhere? I guess not. It won't let me. It won't let me staple it up badly. There we go. Hey! I just talked about this! Strength of closure.
Nope.
Wait.
Excellent.
Oh, I guess it was the opposite way around. According to this.
You've done an excellent job.
Thank you.
Sure this is your first total knee replacement?
No, I played this before.
The patient will remain in the hospital for 3 days.
In this economy?
Therapy. Because of this surgery, our patient will have significantly reduced pain and increased mobility. Before you leave, let's think about the life of the new knee component.
As always,
What
how
kind
to
of
prop.
forces
That's what
do
I was
you think
thinking.
the new knee will need to withstand?
I think it's when it's running. I think it's 4 times, but I think it's 2 times with walking.
Nope.
Nope. I guess it's 3.
Nope. Nice job.
Never mind. I was wrong.
5,000 steps per day. Our patient's new
Not me.
will withstand a great
I
deal of
sit
force
here.
for 36 million steps or more.
We love
We'll
it.
have to check on another patient while the OR team prepares the room for the next surgery. You've been a great help. See you next time.
Thanks for letting me be volunteer surgeon. So there's the virtual knee surgery, and that actually, so this patient will, hypothetically, go to a skilled nursing facility, depending on how much physical therapy he needs, and that's where I used to work. It used to be my job to assist patients, among, other things, who were there for short-term stays and were, like, just getting physical therapy, getting back on their feet after a surgery like that. So that used to be my job, to not do the surgery part, but to do the part where people need help kind of getting up and stuff. I'm not a doctor.